Dr. Joe Jensen from the Metropolitan Heart and Vascular Institute. He will be talking about an introduction to devices and data. Joe Jensen is a general cardiologist at the Metropolitan Heart and Vascular Institute with a primary interest in prevention of cardiovascular disease. He attended the University of Notre Dame and medical school at the University of Minnesota, completing his internal medicine residency at Abbott Northwestern Hospital, being chief resident in his final year. Minneapolis Heart Institute and Hennepin County Medical Center were his home for the final 3 years of his training in cardiology as a cardiovascular disease fellow. If he wasn't busy enough, he took a slight detour working on 2 startup companies during his medical education. Joe now lives in downtown Minneapolis with his wife and 8-pound Maltese-Yorkie, Louie. Thank you, Dr. Jensen, for serving the great state of Minnesota and sharing your knowledge of how to use technology and devices as tools within our healthcare journey. Please welcome Dr. Jensen.
Hi, everyone. Thanks for the great introduction. Really appreciate the opportunity of being here. And I'll just dive right in. Time is a little short, but we'll make it work. So as I continue in my early career as a cardiologist, I find myself referring to the foundation of our practice, guidelines. And these important documents are endorsed by associations such as the American Heart Association, the American Diabetes Association, and they seek to standardize optimal care. And so as I continue to look at these more so now than I even did in training, I see these particular phrases that keep popping up more than ever before. I see things like optimal lifestyle habits. I'm sorry, it's a little small up there. Non-pharmacological therapy, behavior changes. These are class 1 high-grade recommendations in our guidelines. Again, the foundation of our practice. It's amazing that these squishy topics were really never covered in medical school, residency, cardiology fellowship, and beyond. There's hardly enough time to digest these bulky evidence-based guidelines, much less make time and room for these less scientific topics, at least so I thought. In my search to uncover exactly what these phrases meant, I came across Life's Essential 8 by the American Heart Association. And these are what they identify as key measures to a healthy lifestyle. And we can see these here. We're talking about things like healthy eating, increased activity, blood sugar management, weight management, lowering cholesterol, blood pressure management, smoking cessation, and sleep. I find it ironic that we as cardiologists, primary care doctors, endocrinologists, nephrologists, advanced practice providers, nurses, we hardly have the time and the training to understand these simple yet complex topics ourselves, much less have time to address these with patients. To sum this up as succinctly as possible, we are not good at this, nor do we have the time. So who could possibly step in to address these essential 8 lifestyle habits, key measures to a healthy lifestyle, that impact literally everyone alive? And that's industry. There is no way a target market this lucrative could be passed up. So a quick show of hands. I'll ask for participation a couple times during this presentation. Who here owns a smart wearable device? A watch, a ring, a scale, whatever it is? Okay, all right. So a little bit higher, we're higher than normal, which makes sense in this audience. About 1 in 5 Americans own and use a smart wearable device. The market is already large and really is expected to grow exponentially over the next few years. And even in the last 5 years, we've seen it grow from a $15 billion industry to a $70 billion industry, 5 years alone. So it's our job as care providers to understand what's out there, what it means, and start to think about how we integrate this data into our own practice and ultimately our own lives. And so using this Essential 8 as a framework, I'll give a brief introduction and overview to some of the most commonly used devices on the market today. And it turns out that these seemingly simple devices are actually backed by both basic science and outcomes data. So to jump in here, this is a PDF and infographic from the Essential 8 from the American Heart Association, talking about exercise, talking about moving more. Why is it important? Well, it turns out that physical activity is inversely correlated to cardiovascular outcomes, meaning the less you're physically active, the worse you're going to do. Inversely related. And so let's look at the data here. You can see these 2 curves on the left and right here. It's okay, it doesn't have a pointer, but we're looking at big things. We're not just looking at little things like whether or not someone has a nosebleed or a hangnail or something like that, which we can do sometimes in studies. That's a little facetious, but that's beside the point. We're looking at all-cause mortality, people dying. And so if you look, the curve kind of slopes down and to the right. On the horizontal axis is the number of steps per day. The more steps per day, if you get up to the far right side, that's 14,000 steps a day. That's a lot. Your risk for dying is cut in half. These are huge deals. And same thing for incident cardiovascular disease, both fatal and non-fatal. The more steps you take, even starting from 2,000 steps to 4,000 to 6,000 steps, you're benefiting yourself. So it doesn't take much either. What's interesting about these graphs is we even get to 4,000 steps a day, and that makes a significant difference in your all-cause mortality. So why does this happen? There are a couple things that I want to talk about, some semi-scientific topics. I promise we'll get through it together. The first thing is called heart rate. Obviously, the amount of times your heart beats per minute. And it turns out that your resting heart rate really matters. The higher your resting heart rate is in the morning when you wake up from sleep, the worse you do. And so if your resting heart rate is 100 beats per minute, you're going to do not quite as well as someone whose heart rate is below 70 beats per minute. That's kind of the cutoff here. So the other thing that's slightly more complicated, I'm going to simplify it as much as possible, is called heart rate variability. And actually seeing this graphic here kind of gives me nightmares from medical school. There's a reason why I didn't go into neurology, but here we are. We've got the parasympathetic nervous system on the left and the sympathetic nervous system on the right. The way to think about it is parasympathetic nervous system, rest and digest. The sympathetic nervous system, on the other hand, is fight or flight. Both of these systems play a tremendous role in our overall health, but specifically related to our heart. And so heart rate variability is the physiologic variation in duration of intervals between beats. So your heart isn't actually like a metronome. It's not beating on the same interval every single minute. There's actually a little bit of variability between beats, and that's what this heart rate variability is. This is the other slightly bigger part of audience participation here. So I want you to find your pulse, either in your carotid on your neck, which is probably easiest, or your radial on your wrist. We're going to do two things. This is also helpful for me, too. We're going to take a deep breath, and then we're going to breathe out while feeling your pulse, okay? We're going to do this together. Big breath in, and then a breath out. I won't call on anybody to see what they notice, but I'm going to talk about what you just witnessed is physiology in action. So when you inhale, your diaphragm contracts, your intrathoracic pressure lowers, air comes in, more blood returns to the heart, those chambers stretch, that triggers the baroreceptors. You don't need to remember all this, but your heart rate increases as you inhale. The opposite actually happens as you exhale. Your diaphragm relaxes, your chest cavity decreases, there's less venous return, less blood coming back to the heart, you're not suppressing the vagal tone, and your heart rate decreases. So you can do it again, but those are essentially the sympathetic and the parasympathetic nervous systems in action. So we just learned together that heart rate increases with inspiration and decreases with expiration. And higher heart rate variability is better. That means you have more parasympathetic input, more rest and digest, less fight or flight. This is a list of a bunch of studies that show that people with higher heart rate variability do better overall than people with low heart rate variability. But it turns out this metric isn't just for the sick, and in fact, elite level athletes are using heart rate variability as a metric to tell them when they should really push themselves. When they wake up with a high heart rate variability, those are the training days that you really want to go all out. Whereas if the opposite happens, where your heart rate variability is lower than it normally is, that might need to be a rest, recovery, flexibility, mobility day. Athletes have actually done better when they train based on their heart rate variability than if they don't train on their heart rate variability. So why does this happen? There's a bunch of different kind of pathophysiology, physiology things that happen here, but essentially higher heart rate leads to more stress, higher blood pressure, increased oxygen consumption, and lower heart rate variability can lead to arrhythmias and other negative cardiovascular outcomes. The good news is that we can do something about this because increased activity levels can actually lead to a lower resting heart rate and a higher heart rate variability. So there are a lot of tools for this that have been developed over the years. This is a pedometer. This is kind of tracking from where we came in 1760. 1760 was the first pedometer. We have the first pulse oximeter measuring somebody's oxygen level in 1935. We have the first Fitbit product in 2009, and then the first Apple Watch with an EKG in 2018. Now, there was an explosion of devices between the years of 2011 and 2015, and I just have to do this. This one is near and dear to me. Coming out May of 2013 is the Fitbit Flex. And I had the bright idea over 10 years ago now that it'd be a good idea to wear on my wedding day. So my wife wasn't exactly thrilled with the fact that this showed up in all our pictures, but I will say to this day, I'm still talking about it, so I think I made the right decision here. She may or may not agree with me at this point, but it's there. So I've got a long history with these devices. And so how does this work? And again, this is a little bit above my pay grade. I'm not a mechanical engineer, but there are two ways this works: a triaxial accelerometer, which works in the XYZ plane, and a gyroscope. And essentially, those form the 6 degrees of freedom. These are all microelectronic devices, circuits in all of these devices. And you combine those with GPS, you get a lot of people that are a lot smarter than me programming these devices, understanding what happens in running, what happens in sleeping, what happens in all of this, so we can write the software algorithms to get all of that raw data from those sensors, and then have these devices tell us, are we exercising, are we sleeping, are we rowing, or whatever. Pretty cool stuff. And so how does this work? How do these devices work? And there are two different ways that they work primarily. Pulse oximetry, which is what people are used to, especially in COVID times, of checking somebody's pulse. You see that red light, and it's looking at the capillaries. And then there's this other one called photoplethysmography. That's the last time I'll say that, PPG for short. And so what it does, it actually looks at blood volume changes in microvascular, really, really small blood vessels. And all devices use the PPG technique, all the devices that I'll talk about today. And then, of course, the last way to do it is an EKG. People are familiar with the 12-lead EKG that they might get in a physician office, but there are devices like the Apple Watch and the AliveCor that also do this as well. And it's important when I talk about these devices that they've all been tested against the gold standard. So here are 3 graphs. The whole point here is to show that an Apple Watch, a Whoop, and an Oura Ring, I'll talk about all 3 of those, directly correlate with the gold standard of EKG for heart rate monitoring. They're all very, very accurate. Most notably Whoop. The more narrow the bar is, the more accurate the device is. So from a heart rate standpoint, Whoop remains supreme. This chart again shows that a lot of these devices have been studied and continue to be studied in long-term population studies looking at outcomes that I've kind of talked about a little bit so far today. So they're continuing to be used in studies as we go forward. In fact, this one in particular was published in the New England Journal of Medicine, and it actually looked at 420,000 patients over 8 months using an Apple Watch to detect atrial fibrillation. And it actually is quite sensitive and quite specific. It's not perfect. I see patients in clinic that bring in their Apple Watch data not infrequently, and I have pretty good success with it. And actually, it's a really good tool for those people who have arrhythmias very infrequently that we might not catch otherwise. So really important stuff happening in really big medical journals. And so to dive into these devices just a little bit, people are probably the most familiar with Apple Watch. And so the nice thing about Apple Watch is you can get a bunch of different apps on the same device. A calculator, you can get your sleep tracked, you can get your activity tracked, you can do all this stuff and more on an Apple Watch. And you typically pay for the device up front. You might have subscriptions for the individual apps that you use, but it's all in one place. And the nice thing about this technology too is it's a single lead EKG, as I mentioned, so you get pretty good data from a heart rhythm standpoint, as shown by that New England Journal of Medicine article. Whoop is a little bit different, and I purposefully included pictures so you could get a feel for the flavor of their marketing, what their vision is, what their mission is, and in this case, Whoop is here to unlock human performance. So you see a lot of high-level athletes using these. There's a partnership on the PGA Tour. People will argue with me if golfers are high-level athletes. They definitely are, so there's that. And this device is interesting because it stays on your wrist, and you can charge it on your wrist all the time. So this device can essentially be with you 24/7, 365. You got to take your Apple Watch off to charge it at this point. So that's kind of an interesting feature with Whoop versus others. All 3 devices do essentially the same thing. And on the left, their marker of activity for Whoop is called strain. And so you get a strain marker for how much activity you've done during a period of time, a day, week, month, year, whatever it is. They all also track sleep. That's the middle graphic here. The stages of sleep, how many times you woke up, if you exited the bed, all of that stuff is available on these devices. And then finally, your recovery. It all feeds together. So it's how much activity you get, how much recovery sleep you get, and then your recovery score, which is that every single device has their own proprietary algorithm, but it tells you how ready you are to attack your day in whatever you do. So that recovery score or readiness score for Apple Watch or readiness score for Oura Rings, use all of that data to come up with your readiness for the day. This is probably my favorite slide, most impactful slide. So if you take anything away, I think this is super cool. So this is an example of what a workout would look like on a Whoop device. And so you see all the different up and down markers here. That's your heart rate. That's this person's heart rate. And so at the bottom actually is 100. So this whole time the person's heart rate is between 100 and 150, sometimes creeping up to 175 before it goes down. This whole workout lasted about an hour. Again, heart rates, probably the average was 130, 140, 150, so a good workout. This wasn't a workout. This was actually a medical resident taking care of a very sick patient in the ICU. This isn't somebody that's doing chest compressions, jumping on the bed, doing anything like that. This is somebody in the room actively taking care of a very sick patient. And I just think that data alone is so powerful and so important, not just for us as physicians, as care providers in the healthcare industry, but really strain and stress on a daily basis is so under-recognized really in so many professions. And so to be able to see that data here in what would actually be a really good workout for an hour with your heart rate elevated to 140, 150 was just somebody taking care of a very sick patient. This one is interesting too. Whoop is a monthly membership that you pay for. There are a bunch of different things and promotions that they do along the way, so slightly different pricing model than the Apple Watch. Oura, you'll notice everything is softer here. It's a little bit more gentle. Their initial focus when they released was about sleep. And so their priority is sleep, they're exceptional at sleep, and they've gotten better over the years at everything else. And so again, the messaging is just very different. Sleep Tight with the industry-leading sleep tracker. There have been specific studies in combination with mattresses to measure sleep. And then the mattress companies use the Oura data to say, hey, sleep on our mattress. I can prove to you that you're going to get better sleep. And they do. Same thing as the other devices. The rings can track exercise as well. And again, they look at sleep, they look at activity, they look at recovery. The pricing is a little bit different for the Oura Ring as well. You have an upfront $250, I think their new generation, or $350, excuse me, is about the same. And then depending on how many features you want, you can pay for an extra monthly fee. This device, KardiaMobile, is pretty interesting and one that I find myself recommending to patients pretty frequently for those infrequent arrhythmias and those people that might be a little bit less tech savvy. This device is really cool because it's a single lead EKG device that's the size of a credit card. Carried around in your wallet. If you start to feel palpitations, dizziness, lightheadedness, whatever, you take it out, you put your 2 fingers on those silver areas, and you get a single lead EKG. That shows if it's normal rhythm, abnormal rhythm, and I actually have had multiple patients that I've diagnosed with atrial fibrillation based on this data alone that we otherwise wouldn't have captured. And then we can make the appropriate medical decision making based on that information. This is a little bit different as well. They're pretty affordable. The not credit card sized one is about the size of this remote clicker. I think that one starts at $80. The credit card one is about $100. And you can pay a yearly fee as well if you want specific interpretations of your strips by a cardiologist, or you just bring it into your cardiologist if they're familiar with it in your routine visits anyway. So, which one is best? What do we do? What do I recommend to patients? And it's interesting because, again, in I think this was the Journal of the American College of Cardiology, they actually directly compared these devices. And what we looked at in this case was the Apple Watch versus the Samsung Watch versus the Withings Watch, the Fitbit Watch, and then finally the AliveCor device that we looked at. And overall, the best performing device to detect arrhythmias was the Apple Watch. So if someone is interested in specifically looking for arrhythmia, I point them toward an Apple Watch or that AliveCor credit card device. If we're talking about overall health, wellness, stress, rest, recovery, all those essential 8 markers that are important, then I think Apple Watch or a Whoop are kind of individual preferences at that point. You can't really go wrong with any of them. And so overall, what we know is that decreased physical activity, increased heart rate, and decreased heart rate variability they all lead to higher levels of mortality. And the cool thing about this now is with these 3 devices, I can actually get personalized, actionable data from that patient sitting next to me in the exam room. It's not like this. This is a picture of what we have. It's called the pool cohort equation, where we look at a population of people. We plug their blood pressure in, their cholesterol in, their age, their race, whether or not they have diabetes, whether or not they smoke. And we have calculators. That's the best kind of risk assessment that we can do. Those are based on population studies, massive amounts of people. These devices allow me to look at the data of that exact person and then make recommendations for them based on their own individual actionable data. And so to wrap things up, I'd like to peer into a crystal ball in an attempt to see the future. I can see a clinic. Maybe it's a building, maybe it's a room within an existing clinic, and maybe it's not physical at all. Maybe it's a virtual clinic database. And I think that this clinic will teach patients how to use these devices and collect actionable data from a variety of them. Maybe this is some wild fantasy, but I truly doubt it. And all of these devices will lead to better, more individualized care for our patients with truly actionable data. And together with industry, we as healthcare providers can build on this essential aid, and we can build that better future both for our patients and for ourselves. Thank you.